hopefully you feel a little bit more refreshed and you've taken enough time to chill out and have a drink. We're going to come down to the floor and just work on some core exercises like we normally do. Today we're going to do some shoulder bridges on your back. So we're going to do prickly ball work first, then the shoulder bridge, then prickly ball work again. If you don't have the prickly balls, don't worry about it. What you can do is just continue to do the shoulder bridges while we're doing the prickly balls. Or I can give you a glute stretch to do instead. Okay, so we will figure out a way around those of you who haven't quite got your equipment in yet. So the first thing I want you to do is to come onto your hands and knees, and we're going to take the knees quite far back to begin with and just take a little stretch down to the floor and stretch your back out, and then come back up and bring your knees back in, and then just take a little hip sway from side to side. So hopefully you can see me clearly enough to see what's going on. And then drop back down again, take your knees wide, just loosen off your back. And then bring yourselves back up again for another little hip sway. So adjust your knees accordingly. If you feel like you need to bring them back in, then do that. Okay, let's take the ball between the knees. And really all that's there for is just to stabilise your pubic bone and to give you a little bit of muscular strengthening around that joint, because in pregnancy, that point of the pubic bone where the two bones meet, it can become quite soft and slack. And so when you feel pain between that central point of the bones, that usually means that the two parts of the pelvis are sliding around a little bit and rubbing, and that's what causes the pain. So if we have the ball between the knees, it just creates some stability for that joint and it improves the muscle tone around the joint. So doing these exercises with this ball here is a really good plan. Okay, turn your hands in to open up your diaphragm and bend your elbows to take the pressure off your wrists. I'm just going to shuffle slightly so I can see you and you can see me. Okay, first thing we're going to do here is just take a breath in, and as we breathe out, we're going to tilt the tailbone down to the floor and bring your chin to your chest. And inhale, come back and flatten your back. And just make sure that you're not dropping your bottom, or dropping your hips rather, so your bottom pops up into the air. You want to come back to a lovely flat back. So if you've got someone in the room with you, you can get them just to check to see if your back is flat. That's the thing I miss about not seeing you guys, is that I can't walk around the room or scan the room and check that you're all doing the right things. So if anything feels wrong, then you're probably going too deep into the movement for you. So let's keep this mobilization going, keep squeezing the ball. And remember, in our last video I taught you that this position was a really good way to practice breathing for delivery. So inhale, tuck your chin in, and exhale, and imagine you're pushing down into your back passage without actually pushing. Okay, now we're going to take the ball out, and you're actually going to use the ball for this little section. So grab the ball in your hand. If you haven't got a ball, just go with bare hand, and then exhale as you take the ball under your arm, and then inhale and bring the ball up over your head. So there's a lot of waist work going in here, and the muscles of your waist are very much involved in the delivery of your baby, so it's always a good plan to work those muscles. So if you were wondering what you would do without a ball, when we had the ball between our knees, you could use a cushion for that bit. Okay, last one here, rotate and open, and then we'll do the same on the other side. So reset your hands, and inhale, exhale, through you go. Lovely stretch for the back as well. Inhale, open up as you twist. Don't worry if your flexibility isn't very good. You might find that you can only just get the ball up to shoulder height, so let's say maybe about there. That's okay, just go with what feels good. If you're super flexible, you might have to make sure that you don't go too far. Let's have one more. between the thighs if you have one, or a cushion. Turn the hands in and let's circle. Tailbone round and round to loosen off the tight fascial tissue in your pelvic floor and help to make space for your baby so that they can have a field day in your uterus. We need it to be flexible so that they can roll around and toss and turn and generally have a lot of fun inside there. And also as you get closer to your due date, you need it to be quite flexible so that they can really turn and descend into the right position so they can easily get out. I say easily, but you know what I mean, with a little effort. Okay, now release, hold the ball in one hand, slide. Bring it back, same side, slide. Keep the toe on the floor. Can you see what I'm doing there? Just make sure that your toes don't come off the floor because we need to keep your pelvis lovely and stable. And change sides. So hold on to the ball, slide away, tummy nice and relaxed. If it feels like it's tightening up as you slide the leg out, that's okay. That means your muscles are working in their natural pattern. Let's go one more time. Okay, release. Right, let's just take ourselves down for a little release at the back again. Just get your bump all the way down to the floor if you can. And rock from side to side. Okay, bring yourselves back up. Right, we're going to work on the glute muscles now, the muscles of the bottom. And you know, you really do need to have strong bottom muscles because they help to stabilize your pelvis. As your bump grows and grows and grows out the front, your pelvis starts to tilt too far forward and the muscles in the bottom then become tight and weak, and it's really hard to kind of use them the way that they're supposed to be used autonomically. But if you keep using these prickly balls, it helps to keep the muscles relaxed enough so that they can actually work and cope with the tilting of the pelvis. So if you've never done this before, you probably want to order the sisal balls, which are softer so you can get used to it. But if you're a little bit like me and don't mind a bit of pain, you could be brave and go for the harder ones. Now, don't be afraid of the P word. If you feel discomfort, it means that you've found the tight spots. So, and it's really good practice for you to get used to the sensations that your body will give you so that when you're in labour, you're like a pro when it comes to contractions. All right, so onto your elbow, then down onto your shoulder, then roll onto your back. Now just make sure that your ball isn't too far away, just in case, because we're going to need it in a minute. Take your balls underneath your bottom. If you're using something else like apples or tennis balls, exactly the same. If you haven't got any, just do a little release like this for me, alternating sides. Okay? So keep going with that release if you're not using balls. Everybody else, if you're using balls, hands on your ribs so that you can just massage around that diaphragm a little bit and then roll from side to side here. Oh my goodness, my glutes are on fire. We did a lot of filming for our other members who come to our general HIIT classes here over the last few days, and we've also done our own workouts on top of that, and I can tell you, my bottom is on fire. Okay, so we just want to break down any tenderness that you can feel. Just be really relaxed and brave and just work into those tender areas. Try to push firmly down into one side, then firmly down into the other. You don't need to be here for long because we're just preparing the muscles to be used. So you can get rid of the balls now. Then take your ball or your cushion, or if you have neither of those, just bring your knees together so you can squeeze your knees together. If you're doing that version, make sure your feet are together as well. Okay, but if you are with a ball or a cushion, your feet need to be lined up with your knees, not touching each other. So you're going to take a breath in, keep your hands on the floor, and as you breathe out, squeeze your ball and begin to peel your tailbone off the floor and push your hips up to the ceiling. Take a big squeeze Squeeze here, squeeze the ball, breathe in and breathe out, and slowly, slowly, slowly come down to the floor. Now you might feel a bit of shuddering on the way down. That's absolutely fine. That just means your muscles are talking to each other. Breathe in again and breathe out, and squeeze and push and lift, and let your shoulders relax. Let your face muscles relax. Breathe in at the top, squeeze the balls, squeeze the bottom, and slowly bring your spine down to the floor. Now make sure the middle comes down before the tailbone. Your bumps will make it feel like it's not really happening, but it is. Let's go again, one more time. Breathe in and breathe out. Now I don't like to keep you on your back for too long, because of course we don't want to compress all those vital large veins of the body. So we're just going to do a few repetitions here and then get you back on the balls. But I really would like you to do this kind of exercise every day. Just a few minutes every day makes all the difference to your pelvic health and the prevention of serious pregnancy-related pain. So take your ball out, pop these balls under your bottom. You could even use this ball as a little neck support. And let's just roll from side to side. If you don't have the balls, just do your alternating leg stretches, but hold them for just a tiny bit longer this time. So keep moving, rolling gently side to side. And then lift your bottom up, take the balls a little bit further up the bottom. If you are without the balls, hold your stretch for 3, 2, 1, release, and do the same on the other side. So just make it a little longer. Can you feel how lying on the ball or the cushion switches your neck muscles off? Okay. Now, I'm just going to move my ball because I prefer to do the lift without the ball. Lift your bottom up, squeeze, take the balls out, and then slowly, slowly, slowly bring your hips back down to the floor. Good. And then what I want you to do is to roll onto your left-hand side and just stay there for a moment. And we're just going to focus on a little bit of mindfulness. So what I'd like you to do at this point is to close your eyes and pop your hand on your baby. Just begin to notice your slow, calm breath in. Fill your lungs as deeply as you can. And exhale and release any last little bit of tension that you're still holding on to. And if you can, try to focus on your baby and the energy coming from your baby. And just use this moment to send your baby all your love and to let them know that you're here for them and that you are so excited about meeting them. But this is the most precious time that you two have together, these secret few months where it's just the two of you. Don't be afraid. Your baby knows exactly what they need to do to be born. And your body is amazing. It's going to do everything that you need it to do. So if you want to, you can carry on resting on your left and tuning into your baby. Or if you're not in that zone right now, you can bring yourself back to a seated position. Have a little sip of water. And we will tune in again